here, and what I've told each of my patients is you will have your time to ask questions, and that's going to be now. We're not going to give another lecture or talk right now. I just want to open it up to all of you to ask, every question you can possibly think of that you want to get clear, and we'll try one by one address those questions with whoever the more appropriate person is. Dr. Kim down there will be speaking this afternoon. He'll be speaking on, can field some of the questions, macular degeneration. Dr. Petito is a specialist in low vision, has his practice in St. Petersburg. Dr. Kim's with Dr. Tolentino. Any of the diet, nutrition, those types of questions we will field here. So let's just open it up to questions and we'll go from there. Yes?
I have a question.
Yes, Reverend.
I'm taking tips. I'm taking tips. I've been doing it ever since you recommended me about 5 years ago or 6 years ago. Should I take Macular Health Plus tips, or drop one and take the other, or what?
Well, good question. The TEPS does have the lutein, xanthine. It doesn't have the mesoxanthine that Dr. Tolentino has been speaking about. So there probably is some additional benefit that can be gained with that. Also, I like to add the fish oils, the omega oils, and things like that. And then I think your supplementation is pretty good, and then we work on the diet and some of the other areas we've been talking about.
Well, should I keep with tips plus the Macular Health, huh?
Well, TEPS is a complete multivitamin with minerals, and it has some of the herbal components, but it doesn't include the mesoxanthine, which...
The benefit of actually the design of the Macular Health is that it is actually an additive. A lot of the information for mesoxanthine has only been in the last, I got the big paper that I read, I quoted to you, was maybe last year in Academy of Ophthalmology in October. Okay, so all this information is very brand new, so some of the supplementations that you are taking, you should continue to take them, okay? You just need to add, to reflect you want to take lutein, zeaxanthine, and mesoxanthine, because together they work better than each of them alone. Okay, so it isn't meant to be an additive, not a replacement.
Any more questions? Okay.
I'm not sure I heard correctly. Is estrogen considered preventive for AMD?
Actually, what I said is they found out, they did a study, and they found out there are links between estrogen AMD, and the way they did it, those women who got the menopause early, for some reason or another, when they got the menopause early, they increased their risk of AMD as also earlier. So they associate that decrease the estrogen, and it is considered as risk factor, yeah, just like the cardiovascular, because I did mention those risk factors for cardiovascular disease associated with the risk factors for AMD, and estrogen also is one of them for the cardiovascular. So it seems like there's association between reduce the estrogen and increase the risk of AMD.
Can I add to that a little bit? There are a couple of confounding factors to the estrogen data. One, we know that there is more of a prevalence of maturation in women, and the reason why that is because unfortunately women live longer than men. Okay, so if you look at that, that's why there's been always this interest in saying, well, if more women have maturation, then and they of course have estrogen versus testosterone, that's one of the avenues that has led to this kind of research. The other issue is that a study done by my partner, Dr. Gears, she studied nurses, and she discovered that the diminishment of vitamin D actually was more causative, or not causative, but more likely increased the risk of developing macular degeneration. And she studied a cohort of, I think, several thousand nurses, and did not find the link with estrogen. Okay, so it's a tough field to sort of delineate if estrogen does play a role or doesn't play a role. But I really, from my opinion, I don't think it really plays much of a role.
It's more observational studies than conclusive study. That's the difference. There are conclusive study and observational. Conclusive, we say definitely this is the cause. Observational, we just observe and cannot say is the cause.
Yeah, just to add to that, I think it can get very confusing as a patient because there's so many different studies looking at so many different things, saying that X, Y, and Z may be associated with it, and A, B, and C are or are not. And so even as a physician, it can be overwhelming with the amount of information coming at you about what are risk factors and not risk factors. And some papers will disagree with each other, as we've talked about, and some studies are designed better than other studies. And a lot of times, to be really sure of something, you want to see multiple studies all showing similar things. And so with some of these genetic associations with complement factor H, for example, that's something that everyone feels very confident in. There are multiple studies that have shown that, whereas other things for other genes or other dietary or what have you, risk factors may be possible but less clear.
Dr. Kim has just explained why we often look very confused.
Exactly. That's why we disagree with each other all the time.
And that's why you have a panel here.
Yes, sir. Yeah, whoever. Go ahead, sir.
Does this Macular, is that any different from the Ocuvite? I'm to take Ocuvite every day. Would I eliminate the Ocuvite if I'm taking the Macular?
Macular, actually, the Ocuvite is part of the AREDS formulation that we discussed earlier. The Macular is meant to be an additive. Okay, so you take that in addition to the well, depends on which Ocuvite you're taking. Which Ocuvite are you taking?
The one with the lutein?
The one with lutein, okay, that's fine. Don't take the one with the vitamin A. Again, I'm on a high horse about the vitamin A content and the fact that that you shouldn't take the one with the high levels of vitamin A. But yeah, you can take that in addition to the Ocuvite you're taking.
Thank you.
Yes. Right behind you, Don.
Hi, this is particularly for Dr. Tolentino. I'm a little confused about the Bugs Bunny theory because I drink a big glass of carrot juice every morning. And am I doing myself any harm besides taking supplements?
Yes, you are. And again, I didn't go over the basic science behind the way vitamin A works, but I'll go over it a little bit quickly. Your vision is like an engine, and the output is not you driving very fast, but you seeing better. The fuel for that engine is actually vitamin A. If you did not have any vitamin A in your formulation, you would be blind, okay, or you didn't consume vitamin A. Now, the problem with macular degeneration is that it's actually, I told you it's rusting, but what's rusting? What's rusting is actually the byproducts of that cycle. In particular, a byproduct called A2E. So think of A2E as like the combustion material, like an engine has exhaust, right? And remember those big clunkers that had the, like the buses that had the big plume of black smoke that would come out of their exhaust? Well, that's what comes out as we get older in the visual cycle. Now, that stuff accumulates inside our eye, and then it rusts. And it becomes deposits called drusen. Now, the problem with that stuff, this A2E, is that when it reacts to light, it then becomes hypertoxic. A2E starts corroding your vision faster, and you get the advanced dry macular degeneration. In the clinic, we follow this toxic material with a picture called autofluorescence. And we have studied that the more autofluorescence you have in dry macular degeneration, the more likely you will lose vision from the corrosion of dry macular degeneration. So, we are developing drugs, which I believe Dr. Kim will talk about later in the afternoon. And one of the drugs that has been shown to slow down the corrosion process is a drug called fenretinine. Fenretinine, we were one of the major sites to study it, was a drug that made you vitamin A deficient. And it would slow the progression of your disease by 50% in 18 months. Okay? Now, the only thing this drug did was it made you vitamin A deficient. So why the heck are we giving you 25,000 international units of vitamin A? So I went back and I talked with my dad's partner, who was the founder of formulation. Her name was Joanna Seddon. And we got to the bottom of why they studied vitamin A in the first place. And the story that I told you, which was there was a government official at the National Institutes of Health that said that my mom said vitamin A was good for you because Bugs Bunny's eyes are really great. That's why we studied it. Okay? That's really great science. And you know, I've worked in some of the best institutions in science, and that's not the way I do science. So that's why I'm on a high horse, because the government still is telling us that we have to prescribe large doses of vitamin A, and I tell you, that's not good for you, especially if you have advanced dry macular degeneration. Now, eating 1 carrot or 2 carrots is fine, but if you have more than 10,000 international units of vitamin A, you know what it's going to do? It's going to make you see better. But in the long term, it's going to make your macular degeneration go faster. Just like putting nitrous into your gas engine. You know, you're going to drive really, really fast, but then look at the engine, what happens to it after, like, you know, a year of doing that. So that's how I explain it. I didn't talk about it, but that's really the premise behind the science.
Thank you.
I just wanted to say about the vitamins, supplements, and diet, because I see that a lot in my clinic, that people doing something good to themselves, and honestly, somebody once upon a time, one of my clients or patient wrote me a bag because I told him everything that you take, bring it to me. And he had about 17 supplements, 17 bottles of the supplements. And what I've seen, he had actually reached the level of toxicity. And he had the symptoms what we had, why the physician in the first place referred him to me, because the physician couldn't understand why he was having those problems. They did every test. So eventually he said, you know what, maybe something wrong with your nutrition, send it, and he had reached the toxicity. And something with the vitamin A, if you have increased vitamin A, just like other vitamin like E and vitamin D, I think those are fat-soluble vitamin, and they could be dangerous, meaning fat-soluble vitamin that once you take them, it's absorbed, it stays in your body. All right? And then if you reach the toxicity, it can also damage your liver and other things.
Okay, any more questions? Okay, good.
Back to the vitamins we're talking about. For instance, you have the tabs, and this man talked about it. The man talked about this earlier. He took the tabs, and then he's going to takes the Macular. So, with this conversation about vitamin A, what do you recommend we do if we're taking a multivitamin and that includes all that A?
It only has 200 international units. We're talking about 25,000 units of vitamin A.
Right. I'm not telling you not to have vitamin A, because I told you, if you don't have vitamin A, you go blind, okay? But it's when you start taking these mega doses, 25,000, that's 1,000 times more than what's in the tabs, right? You need to have vitamin A. And I'm saying, don't stop eating carrots, just don't eat too much of them, okay? That's all I'm saying.
I just wanted to know about the combination of these vitamins that include all of that A. Some of them have 10,000 mg.
Exactly.
So that's okay? Plus what we get in the diet?
Sorry, that's what I was mentioning. It's very important you have to look at your supplements, because some of them, they take supplements, and the other one, it has supplements, or the first one. So it's very important to stick to the number what is the IU? You have to take it to the doctor or the nutrition to see how much. Some of the vitamins actually I've seen, it has the lutein, it has the zeaxanthin, it has other anti-inflammatory things like grapeseed extracts and bilberry, and it has vitamin D, zinc. It's the whole thing in one bottle. That makes things easy if people get confused. Otherwise, if you have different bottles, you have to add it up and really have to discuss with a physician or nutritionist in order to make sure that you are not overdosing yourself and reaching the toxicity level.
Thank you.
Ms. Fincher.
Yes, Dr. Dupree. Question, switching from vitamins, since I've had 19 or 20 injections, what is the OCT? I heard that mentioned. And also the actual reason for the injections is to stop the bleeding. Is that correct? I'm an artist, I'm too dingy.
A very good artist, actually.
Thank you.
The OCT is that scan that we do, and that just allows us to objectively measure how much swelling or fluid is there in the macula, to kind of see if the shots are doing what they're supposed to be doing. And if the fluid level is coming down and we don't see any active bleeding, then the shot is doing, what we want it to do. If there still is activity or the swelling doesn't go down, then sometimes we're looking at some other approaches with the cold laser, the Visidyne, some of those things that we might couple with the treatments that might be more successful. But some eyes that have a lot of damage are very hard to get completely dried up. And sometimes we're just trying to keep them from bleeding, where that could end up being worse.
So how often do you do the OCT? Not before, several times a year?
Oh yeah, we do it usually before the shot.
Before the shot?
Yeah, most of the time we're monitoring the shot with that scan.
What was the laser one that I'm chicken to do?
That's the cold laser, the Visidyne treatment.
Visidyne.
Yeah, which, we can cover that. That's kind of an old therapy. Well, 7, 8 years ago was state of the art. And we were able to make it work to some degree, but now there are some areas where some of these more chronic leaking maculas, coupled with an injection, paired with injections, I've had personally some very good experiences with that. Dried up some maculas and had some really nice vision improvements. How long is it going to last? We have to monitor it and kind of stay on top of it. But we're hoping to get a more stabilized macula that maybe doesn't require shots as frequently or something to that effect.
Thank you.
Okay, we've got time for 2 more questions, and we will answer more questions later this afternoon.
We have a question over here.
Okay.
Did I understand correctly that molecular sunglasses are good for preventing AMD? And if so, how do I tell if mine are molecular?
Molecular sunglasses is a term I pretty much coined, okay? This mesozeaxanthin lutein zeaxanthin complex in a set ratios, usually 10 milligrams, 10 milligrams, and 2 milligrams. It actually upregulates, not upregulates, but it causes, it protects the area in the center of your vision with a filter. It increases the pigmentation, and this filter is actually a blue light filter. Now, most people think that UV light is what causes problems for the eyes. Actually, that's not true. The most damaging wavelength of light is blue light for patients who have macular degeneration. And the reason why that is again because of that toxic product I was telling you about. So all that rusty, toxic junk that's in the back of your eye, right, if you have macular degeneration, if it gets exposed to blue light, there's a chemical reaction that makes it more toxic. So what you need to do to protect your eyes is to really block blue light. Now, you can do that by taking the mesozeaxanthin, lutein, and zeaxanthin complex. You can also wear certain kinds of sunglasses. They're called blue-blocking sunglasses. Coppertone makes a brand which it's copper. Actually, blue-blocking sunglasses are sort of amber brown, okay? And they are actually what I recommend to patients who have either advanced dry or advanced wet macular degeneration, and one is still not, because that's going to block the harmful blue light, and we get a lot of that. I mean, you know, everywhere we get a lot of that. So blue blocking sunglasses, you can either get either as a molecular perspective using the Macular vitamins, or you can buy them from Coppertone or tint your glasses that way.
Just one other quick thing aside is your own, if you have your own cataract, your natural lens in your eye, it becomes yellow and it's almost like a natural blue blocker. It's still a good idea to probably wear some blue blocking sunglasses over the top, and then once they put the implant in your eye after cataract surgery, they're all UV protected also and down into the blue wavelength. So most people have at least some protection. It's not like if you walk out instantly, you're going to have an immediate problem. If you're out for extended periods of time, especially, I'd double up, you know, with some good glasses, good sunglasses. That's Dr. Petito.
I'd like to add, Dr. Tolentino said it's not really UV damages. The correct statement would be it's the blue light damages the retina, but the other parts of the eye are susceptible to UV.
Right. Your skin. Sorry. Yeah, right, exactly.
You know, the cornea, the lens becomes a cataract mainly due to oxidative stress caused or mediated through UV light. So I just want to make sure that we don't lose sight of the fact that UV protection is important for other reasons other than the retina.
I apologize. Thanks.
We are retina.
Right.
I didn't want to mention that problem with these guys over here. They're all retina.
Okay.
All right, we're going to have lunch. We'd like to be back at 12:30.
1 second, Larry. I have one patient that's been waiting to ask one quick question.
My question is, I have problems when I go into this very, very strong sunlight bothers my eyes. Did they hear me?
Her question was, when she's out in the sun, the sun really bothers her eyes even with the sunglasses.
Dr. Petito, you want to field that one? Light sensitivity.
Well, that's the catch-22 that macular degeneration patients face all the time. They're more sensitive to light from the glare perspective, but they need more light from the retinal perspective. And many times, and in my presentation we'll get into some of this a little more, many times they have some other factor that's increasing their glare sensitivity that we need to deal with, so that sensitivity drops to the point where sunglasses can control it, where you're comfortable outside. And I have patients that come to me wearing sunglasses in this light that, you know, are that sensitive, but they have something else that's causing that we have to diagnose and deal with. So that's the usual scenario, that something else has gone on. They have a posterior chamber lens, and behind that there's a membrane that's cloudy that's causing too much glare. Or they have dry eye that's too severe and is causing too much glare. So many times there's something else that's responsible for that.
Would an eye disease such as iritis do it?
Absolutely. Yes. See, that's another factor. You know, you can have something else going on.
Is there any way to help that?
Sure. These retina guys may not be the right guys for that.
It is true sometimes retina specialists are so focused that we are, so to speak, blind to other things. But iritis is something that we can detect on a clinical exam. Any retina specialist will be able to see that. And so just to comment on the light sensitivity, there are multiple reasons why a given patient might be more light sensitive compared to someone else. And some of those are reasons that do not require active treatment. You know, some of the things that we've talked about already. But you are completely correct that iritis, which is an inflammation within the eye, is something that would require active treatment, but it is something that your retina doctor, believe it or not, would be able to detect.
So I just want to add that Dr. Kim is actually one of the lead investigators for a national trial for inflammatory conditions of the eye. He's testing a new molecule that is very promising for your type of condition. Somebody who has inflammation inside the eye. You know, that's why he's the right person to talk about.
And so that somebody else, you know, one of the terms you hear is iritis, the other term is uveitis. That will, and yeah, I was teasing these guys, retina specialists, I treat uveitis all the time. That's one of their bailiwicks. So just a little poke for those guys.
Okay, well, thank you all very much. I want to give you a half hour to get something to eat, but we will start at 12:30. Thank you.
I also want to just give the microphone real quick to Freedom Scientific.